This presentation consists of two parts. In this first part, it covers the basic concepts. In the second part, it deals with a video on how to examine a patient along with a few practice MCQs. First of all, let's learn what is meant by an alcohol. It is a class of organic compounds characterized by the presence of one or more hydroxyl functional groups attached to a carbon atom. There are basically three types: primary, secondary, and tertiary alcohols. Out of those, the secondary alcohols are the three types of alcohol that humans use in everyday activities. Common examples for the second category, the first one is ethanol or ethyl alcohol. This is the type of alcohol found in alcoholic beverages. Methanol or methyl alcohol, actually it is a toxic alcohol used in industrial applications and not safe for human consumption, and we have to learn something about this type as well. The third type is isopropanol or isopropyl alcohol, and it is used as a disinfectant and in personal care products. We have learned different kinds of alcohol. However, in everyday language, alcohol refers to ethanol or ethyl alcohol, which is the alcohol found in alcoholic beverages or used in recreational activities. Ethanol is the type of alcohol that is safe for human consumption when consumed responsibly or in moderation. There are three major characteristics. It could be a nutrient or an energy source, a toxin, and as well as a psychoactive drug. What do you mean by a psychoactive drug? It is a drug or a substance that affects how the brain works and causes changes in mood, awareness, thoughts, feelings, or behavior. Alcohol is colorless, volatile, and flammable liquid. It's time to learn how alcohol is produced. Alcohol is made by a chemical process called fermentation. Yeasts will act on sugary substances such as grapes, corn, sugarcane, apple, beetroot, etc. So the process of fermentation will occur. It is not only our primary concern of alcohol that is produced with the fermentation, but there may be certain other secondary substances as well. Such substances are termed congeners. It is comprised of various organic compounds aside from our primary alcohol. It is a group of chemical compounds that can include aldehyde, esters, higher alcohols, and other compounds. The most important thing that I want to highlight in relation to these congeners is that it adds the flavor, aroma, and color to the beverage. So now we are going to learn about our primary concern of alcohol. That means it can be used in two ways. This alcohol can be used as it is, that means without having the process of distillation. So as you can understand, it contains the secondary substances such as congeners. So obviously it should have a strongest odor. Certain examples are wine and beer. Now let's think about the process of distillation. Now in this case, the fermented ingredients will be heated to produce vapor. Then this vapor is condensed into a liquid producing higher concentrated alcohol. So they often range from 40% of alcohol by volume to 60%. So now you can understand with the distillation, it concentrates the alcohol and eliminates some of the congeners, leaving a weaker odor as well. For this kind of alcohols where distillation is applied, termed hard liquor or distilled alcohol, spirits. Certain examples are whiskey, vodka, rum, gin, tequila, and brandy. Summary to the earlier slide, there are two forms of alcohol available for consumption. Distilled alcohol, beverages go through the process of distillation after the fermentation. Here, the alcohol by volume concentration is more and the odor is less. Whereas to that, in case of undistilled alcohol, it is just the primary solution that we are going to use that is resulted with the fermentation. Does alcohol have a smell? The primary substance or the alcohol itself is usually odorless. The scent of an alcoholic beverage is from congeners, which are byproducts produced during the process of fermentation. Beer and wine, which are undistilled beverages, basically less potent and tend to have a stronger odor. Stronger drinks like scotch have milder scents, whereas to that, vodka has minimal odor. The important point to highlight here is it is deceiving that if one decides the consumption of alcohol with the smell alone. Moving on to the action of alcohol. Actually, actions are multiple. However, here it is limited to certain aspects only. Gamma-aminobutyric acid and dopamine are two neurotransmitters in the brain that play significant roles in the effects of alcohol consumption. As you know, alcohol depresses the CNS, leading into behavioral and biological alterations with feelings of relaxation, and also it leads to reduce the anxiety. Hence, the person consumed will perform outside of their comfort zone. So, the responsible neurotransmitter for that is GABA. Moving on to the dopamine, it is also a neurotransmitter associated with the brain's reward and pleasure pathways. It plays a key role in reinforcing behaviors that are pleasurable or rewarding. So with the consumption of alcohol, with the enhanced GABA activity, it leads to relaxation, as you can understand, and also it reduces the anxiety. At the same time, with the help of the dopamine, the feelings of pleasure and reward also are there for these people. However, we also have to understand that the long-term effects are multiple. An increased risk of developing several types of cancers, cardiovascular diseases, and physical and psychological dependence as well. Regular consumption of alcohol actually leads to tolerance, dependence, and addiction. Tolerance, dependence, and addiction can all go hand in hand. There are different meanings, however, I am not going to explain all here. As I have described earlier, alcohol affects the brain's reward system by increasing the release of neurotransmitters like dopamine, and it causes or it helps to have pleasurable feelings. However, with the time, brain will rely only on external alcohol for dopamine production. Now you can understand what will happen to the person. So if alcohol is not consumed, the person will begin to feel run down and they cannot function normally. So this is the point where dependence and withdrawals will come into play. It is very important to study about metabolism of alcohol. Why? The time duration that alcohol acts maximally on the body and to understand the rationale of the tests that we are going to use in turn should be based on the metabolism of alcohol. So let's first think about absorption. Once alcohol is swallowed, it is not digested like food. It is first absorbed through the tongue and mucosal lining as well. When it is entered the stomach, 20% of the substances are absorbed and the rest by the small intestine. After the absorption, alcohol is distributed throughout the water in the body. So, it will be distributed in the blood and also in the organ systems as well. I have to emphasize one point here. Now, placenta also gets alcohol. As a result, there may be withdrawal symptoms of the baby after the delivery. So you have to know that fact. And one of the next important point is very little alcohol enters fat because of fat's poor solubility. Blood and tissue concentrations are therefore higher in women who have more subcutaneous fat and a smaller blood volume than in men, even when the amount of alcohol consumed is adjusted for body weight. Let's talk about elimination of alcohol. 90 to 95% of alcohol is broken down by the liver, and the remaining 5% actually will be eliminated unchanged primarily through the lungs, sweat, and urine. Only about 1 to 2% of the percentages that are eliminated as unchanged will be eliminated through urine. The ethanol in alcohol can be detected in a person's urine within an hour of drinking, and it typically remains detectable for up to 12 hours after the alcohol consumption. Now it's time to learn about alcohol testing methods and important findings. The following is an estimated range of times or detection windows during which alcohol can be detected by various testing methods. But there may be certain other exceptions as well. Regarding the breath, alcohol can be detected in your breath via breathalyzer test up to 24 hours. But you should know breathalyzer test is done only by police, not by a doctor. When it comes to urine, now there are two ways that alcohol can be excreted via urine. The first thing is as unchanged and as uh, metabolization. So as unchanged method, we can see alcohol itself up to 12 hours, and when it is metabolized, we can see ethyl glucuronide for up to 3 to 5 days. Blood alcohol show up to 12 hours. Saliva may show up to 48 hours. And hair, like many other drugs, alcohol can be detected with a hair follicle drug test for up to 90 days. As you can understand now, the testing method will be varied depending on the situation. So if it's an acute case, you know what to test now. So moving on to the urine tests, as we have described, there are two ways of elimination of alcohol via urine, metabolized and not metabolized. So if you are going to test about unmetabolized or non-metabolized way, such as ethanol itself, it is useful in case of post-accident investigations. But it had been elapsed some time, so you can test for metabolites such as ETG, and also it will be very helpful to monitor um, abstinence in addiction treatment programs or workplace testing as well. As you can understand, obviously, hair tests are important in case of chronic usage only. Moving on to the alcohol's effects on driving. As we know, alcohol is a central nervous system depressant. It slows the brain and nerve function, including heart rate and breathing. And also anything controlled by the central nervous system, such as thought processes, emotional responses, and motor coordination, also will be affected. For a safe driving, it requires a proper vision, a proper coordination, correct judgment, and also quicker response along with a better muscle power. The slowing of the CNS can lead to slowed reaction time, impaired vision including blurred vision and also reduced peripheral vision, loss of coordination, decreased alertness along with impaired judgment. So as you can understand, consumption of alcohol affects the normal function. Now I want to highlight that the degree of impairment is usually proportional to the blood alcohol concentration. If so, to determine when a person is incapacitated with a considerable blood alcohol level up to a level that can't have a safe driving is a critical point to be appreciated. As a result, there should be a limit to demarcate the both. If a person is unable to control his normal functions, he can't have a safe driving. Our next effort is actually to discuss about the available methods to find whether a person is affected by alcohol or not. There may be instances that a person had consumed a very little alcohol, but still he can manage himself to a normal level without any problem. However, there are certain imposed cut-off legal limits by law to determine whether a person is under the influence of alcohol or not. Let's learn about methods available to detect blood alcohol consumption levels or blood alcohol levels. There are direct and indirect methods. Direct methods means these are basically very objective methods. And whereas to that, a doctor can also conduct a clinical test or tests to determine about intoxication of the person resulting on the clinical findings. So let's discuss about these aspects. Blood tests, breath tests, urine tests, and saliva tests, along with hair tests. So these are very objective and these are basically can be named as direct methods. Whereas to that, clinical evaluation for intoxication by a medical officer or a judicial medical officer can be considered as an indirect method because it is not going to measure any value. Instead, it is going to assess about certain functions of the person. So here we have to have the proper authority first of all, then have to take a good history, consumption and the type and the time, whether he has taken it empty stomach or not with by used carbonated drinks as well, etc., etc. And then about observations. With observations, you have to ascertain about his manner of walking, whether he is aggressive, and how he talks about and about clothing as well. So we can take a clue. And under the general examination, we have to perceive about the smell of alcohol and his ability of the orientation about the date, time, place, and etc. And about speech, whether it is slurred or oriented, and the pulse, blood pressure, and the temperature, and the tone. And as per the specific examination, now there are certain things that we have to appreciate by a medical officer. So it has three parts basically. We have to do the eye examination and lateral nystagmus is considered bit of an interesting or important point. And for the impairment tests, so we have to see his divided attention. For that, we are going to do Romberg balance test, walk and turn test, one leg stand test, finger nose test. And to test about his reaction time, we can do the test called ruler drop test. However, with all these tests, there are certain other additional or miscellaneous tests where a medical officer can perform on his own to think about his decision to tell whether the person is under the influence or not, such as testing about muscle power, For coordination, he can do finger-to-finger test, reflexes, and test for dysdiadochokinesis, heel-shin test, tests for fine movements. Mentioned here is the summary of the guideline for clinical examination for drunkenness by government medical officers prepared by the College of Forensic Pathologists. You can read it up leisurely. As the summary, we have learned what is meant by an alcohol and its types, action of alcohol on the body, how it affects the driving, how to determine the blood alcohol levels by using clinical tests or lab tests, and as well as by using the clinical examination that should be performed by a government medical officer. However, as doctors, we should know how to determine whether a person is under the influence of alcohol or not with the clinical examination itself. The part 2 will provide the rest of the details in this context, and thank you.